Today we are working with a bad leg, now considering that it possibly could be lipedema, and in most cases it's possible that you will get diagnosed with it. Before assuming this, we want to break up the fascia and see if the fascia, or the umbrella term of adipofascial issue, could be the direct correlation of the lipedemic type symptoms. It doesn't necessarily mean it is lipedema, but it's a possibility. And in both circumstances, myofascial therapy is actually very beneficial for both factors. Now we can see that there is a lot of tension both right here on the IT band, pulling on the vastus lateralis, and going all the way into the patellar tendon, which is going to be around this region. So you can see these bumps right there, and that's going to cause restriction to the knee as well. So we're going to go in and we're going to scrape in. We've effleuraged the area, a light passing with the hand, and I can feel it and I can kind of understand what's going on underneath the skin. I get the idea of what the fascia is doing and allow the body to dictate what kind of therapy this person needs. So here I go, I'm working through all of this and just flowing with it. Now the other thing that you want to do when you're working with this kind of issue is you also want to include myofascial decompression. Then that means that it does definitely need to be pulled apart. You don't want to just attack from one angle where we're just seeing if it's going to be stuck together. If it's compressed, it's just going to move the ball. It's not necessarily going to pull it apart, which is what we need to alleviate some of the tension. They actually are compressed. It will cause a lot of restriction, and this will prevent proper recovery, and it'll also prevent performance. So if you have a lot of adhesions, you get what's called muscular inhibition. And muscular inhibition is where two muscles get stuck together via fascia and then cannot activate. So thus you get pain while trying to activate your muscles, and then this makes it extremely difficult to be active. So it's crucial to get all of this tension worked out. Now we're going to go through all the way through, detail this, and we're going to check back in a moment. But this is where we're starting, this first few moments of the session, and we will check back. So now we're going to go ahead and apply these cups all the way through. There we go, perfect. Okay, so notice it, we followed it, and we followed it all the way down to the patellar tendon. We are going to wait for 5 minutes, and we're going to see how this looks after. Now what we're going to do is we're going to go ahead and take off these cups. See a little bit of discolorization right there because we didn't really work there too much. But what the cups did tell me is that there is tension that is pulling to the back of the leg. So given if we have enough time, we are actually going to be working on the hamstring. As you guys can see, look at that difference. Look at how much smoother it looks, and it feels smoother, way smoother. It's looking pretty good. Okay, just as we can see, right in this area, we can definitely tell that where we cupped is looser, but right here is where a lot of tension is. Now, I only have about 10 minutes, so I'm gonna work really fast. Let's see how it looks in a moment. So this is post right here. After doing the scraping for about 5 minutes, now we're gonna cup. Now we're gonna go ahead and leave these on for about 5 minutes. We just did cupping, and you can see how relaxed it looks and how much less tension there is. Feeling a little bit looser? Mm-hmm. Good. All right, excellent.